Hi everyone, today all of you will be learning about informed consent with us, Emer, Wei-Hin, Jasmine, Marcus and Yurin. So have you guys heard about the Helsinki Declaration? It was developed by the World Medical Association and it says, in any research on human beings, each potential subject must be adequately informed of the aims, methods, sources of funding, any possible conflict of interest, institutional affiliations of the researcher, the anticipated benefits and potential risks of the research, and the potential discomforts it may entail. The subject should be informed of the right to abstain from participation in the study or to withdraw at any time without reprisal. So now that you have an idea about informed consent, let's talk about how informed consent is meaningless to the poor. Well, first, what does it mean to be poor? Being poor can fall into a number of categories, such as a lack of income, basic needs, capabilities, and education. Poor people around the world have been taken advantage of for medical research purposes for many years. So let's go back to the 1940s. Have you guys heard about Nazi medical crimes? They were conducted by Nazi physicians during the World War II. Medical experiments were performed on thousands of camp prisoners, including deadly studies and tortures, injecting people with gasoline, live viruses, immersing people with water and forcing them to ingest poisons. The prisoners were forced by the Nazi physicians and nurses, although they did not willingly volunteer and no consent was given for the procedures. Since then, Nuremberg Code has been created and one of its core requirements is voluntary, well-informed, understanding consent of the human subject in a full legal capacity. And even more recently, in February 2003, 100 people with HIV/AIDS from a village in China had their blood samples collected by doctors and nurses from a hospital in Beijing. 19 of them were notified to come to the hospital and receive treatment. Patients did not know why they were chosen, nor did they know the nature of these tests. Some challenges of the case. Consent forms containing complicated medical English and medical terms were used. Most of them were illiterate and knew no English. Nevertheless, they still had to sign the contract. Patients did not receive copies of consent forms from medical staff, saying it was useless for them. Poor farmers who were desperate for life-saving drugs did not fully read the terms and conditions of the study. So how would we improve? Each participant should be given a copy of the consent form, and the issues and concerns of the study should be carefully explained to them. Now that we've reviewed two cases involving informed consent, we will now review some general obstacles to informed consent and how we would overcome them. So firstly, comprehension and capacity. Language barriers can be overcome with the aid of an interpreter, but there might be cultural bias that might lead to compromise of understanding. Literacy. The ability to understand consent. It is pointless to obtain consent from those who are illiterate as they aren't able to understand. But to be illiterate does not signify the inability to understand. It just means the information should be presented in a special way using a visual aid or interpreters of their culture. Autonomy. Autonomy varies differently between cultural groups. In any situation, always give respect to individuals' choice before any others. Disclosure. The custom in many parts of the world, especially Southeast Asia, is to tell the relatives rather than the patient first. Healthcare personnel will work with the patient's family to prevent the patients from discovering the diagnosis. Familiarity with the research methodology. The population have a poor understanding of science and lack of education, which could lead to trust issues on medical research and create a huge problem. You should slowly teach and guide them. Power relationships. Rural patients fear the consequences from researchers if they are not compliant with the research. And finally, some considerations for good informed consent. strengthen the capacity for independent ethical review protocols, develop culturally meaningful approaches to informed consent, apply appropriate standards of care and provisions for medical treatment, provide ongoing feedback to the study participants and community, and finally, develop plans for resolving conflicts surrounding research implementation.
That concludes our presentation. We hope you've learned something about informed consent and why it is important. Thanks for listening.